We're talking skincare. Joining us today from Living Well Aesthetics, we have Dr. Jared Chapman. Great to see you. Thanks for taking time to talk with us.
Great to see you, Susan.
Yeah, and talk to me about filler face. What is this? And it sounds like something we might want to avoid.
Yeah, so it's all the rage on TikTok and social media right now, and everyone's talking about how filler can make your face look fatter, how filler can make your face look pillow-like, and the bottom line is, yes, it can if it's used improperly in the face and placed in the wrong areas. But filler actually is used to soften the lines, to lift and contour the face, and actually make the face look more sleek and more youthful when it's placed in the proper positions in the face. So understanding the anatomy of aging is the first thing that has to go on, and the provider needs to understand what they're seeing and why they're seeing it, and then correct the underlying problem rather than just putting filler in the face and filling lines and wrinkles. A lot of times, I think we're just early on, especially, we were taught just fill the line, fill the wrinkle, and we've moved so far beyond that now. And as providers of aesthetic medicine, we need to understand the anatomy of aging and how to place the filler properly so that we get a lift and contour to the tissue rather than just a fill.
Right.
I try not to use the word filler with a patient because that implies I'm going to make you fuller or give you more volume, and that's not necessarily what every patient needs. A lot of times we have sag and we have pooling of the tissue in a lower area because we've lost support mainly through the mid-face. And so when we place the filler strategically and the proper amounts strategically in those areas, we get a nice lift and contour that actually makes the face look thinner.
So it sounds like, Dr. Chapman, it's really important to have those conversations and have that consultation so that you all can decide what the patient needs and to what level that they need so that they'll still look natural.
Absolutely. Every patient that comes into Living Well Aesthetics gets a full face assessment. Even if you're just here for skincare or you're just here for, say, I just want Botox, I just want the lines on my forehead corrected. We always sit down with every new patient, do a thorough history and physical on them through their medical process, and then look at the aging process and figure out how that we can help the aging face look more rested, more youthful, and definitely maintain their authenticity.
Yes, and make it look as natural as possible. So if someone does want to come in and have that consultation to see if maybe this is right for them, what's the best way to do this?
So they can call the office, 304-205-4041, or they can text us at 304-989-2065. That gets them in touch with both locations, both Charleston and Milton, and they can request which office they want to make their appointment. And then when they come in, we'll do a full face assessment on them. Our consultations are free. The initial consultation is free, and then we determine what would be the best aesthetic plan for them. And then over the process of, a year, we can plan out exactly what we feel like they might need to really make the face look rested and rejuvenated.
Right, because I would guess that some people may only need a little bit and others may want to keep doing it for a while. It would depend on the patient. Yeah.
We create that aesthetic journey for each patient. It's individualized.
Great. Well, Dr. Chapman, thanks so much for talking to us today about fillers.
Thank you for having me.